the cold Whirlpool, and Kylie's going to tell us about the mechanics behind it a little bit.
So you want to make sure it's plugged in, of course. The handle in the back, I don't know if you can just see this, back here, this handle is going to raise the whole thing up or down. This little switch on top is going to turn it on or off. And then we have this little thing here that spins. That's going to change the pressure of the jet that's coming out. If you turn it all the way down to where there's no pressure, water's going to come out of here. So make sure you have that in the tank. And then you can also move this side to side if it's too much for them to have it directly near their body part.
And then with the jet, you want to make sure it's about 6 to 8 inches away from the injury. So that's, again, with raising it up and down, you can get it to where you want it on depending which body part. And then, so the contraindications for this would be lack of normal temperature sensibility, just a hypersensitivity to cold, vasospastic disorders like Raynaud's disease, which is mainly in your hands, and then coronary artery disease or hypertension.
Or open wounds also.
Yeah. And so if I was the therapist and Kylie was my patient, I would do the Blanche test, and we'll be doing her wrist. And so I can just push on her, well, I guess if she has a wrist fracture, you push a little above it because you don't want to be on the injury. And then make sure her skin color comes back within 3 seconds. And then I'll ask her to close her eyes. And then, yep. And so she can feel that with her eyes closed. And then we want to make sure that's plugged in. This towel here is so it's more comfortable for her. And then we have everything adjusted. We're going to make sure her hand's clean before we put it in. Checking the equipment. Her body mechanics and my body mechanics are good.
You want to make sure you check the temperature of the water and that there's no ice left in there. Make sure it's all melted.
Good call. And that the temperature's right there. And then the water is generally about 10 to 16 degrees Celsius. And then 20 minutes, I believe. I think 20 minutes is a good answer. Or yeah, depending on the patient, yeah. But I guess that would be a better answer. So the stages of healing, cool, tingling or burning,
aching, and numb.
Thank you, patient Kylie.